Ulawanaka and welcome to For the Record. 1 in 5 adolescents in Fiji is overweight or obese, and this leads to non-communicable diseases such as diabetes now being found in children as young as 12. Our topic tonight is childhood obesity, and my guests are Dr. Isimeli Tukana, the National Advisor on NCDs at the Ministry of Health, and Elisiva Nahati, the National Advisor on Public Health and Nutrition at the Secretariat of the Pacific Community, or the Pacific Community as it's known now. Getting into it, Dr. Tukana, I'll begin with you. When we talk about 1 in 5 adolescents being overweight, give me a description of how urgent and how big the problem is for Fiji.
1 in 5, this is a study that was done in 2010, Global School Health Survey, where we studied Fijian children who are 11 to 13 years old. Now, which means 11 years down the line, 20% or 1 in 5 of Fijian children are overweight and also obese, as early as now. As you said, NCD is a lifestyle disease, and if we were to deal with lifestyle disease, we should start from pregnancy. But now we have a situation, because lifestyle starts at pregnancy with mom and the child. Now we have a situation where we have shown that at 11 to 13 years old, 20% are already overweight or obese.
How does that come about? I mean, all this while we've spoken about NCDs affecting people in their 30s, 40s, 50s. How is this now emerging among pre-teenagers?
Now, as I've said, it's lifestyle. And all over the world, there's 4 lifestyle that we need to address: smoking, nutrition, alcohol, and physical inactivity or lack of exercise. Now, imagine this 11 to 13 years old, you minus smoking and you minus alcohol. So you are left with nutrition and exercise. So the equation is, if you are eating well and exercising well, you'll maintain. Obesity arises when there's not a balance between eating and exercise. That's a simple equation that we need to grasp. You're eating. We won't stop Fijians from eating. We will try all Fijians to do exercise so as to reduce obesity. So obesity comes up if there's an imbalance between eating and exercising. That's the equation that we need to sort out. The alcohol and the smoking part.
That doesn't involve children at this stage. Elisiva, from the Pacific Community's perspective, looking at recent history and how our lifestyles have changed, how our eating habits have changed, is there a common factor, not just in Fiji but across the Pacific, that's resulting in this obesity?
Yeah, I think it's as Dr. Tukana mentioned, it's a common knowledge in all Pacific countries. The fact that there is a big change in the way we eat, what we eat, and the amount and how food is being prepared. So in all the Pacific countries, it is being, as surveys have detected, that there's a high prevalence of obesity because the way people, the dietary behavior and the dietary habits have changed a lot over the years in terms of the introduction of the westernized foods, foods high in calories, like the sugar, the sweet and sugary beverages. There's also the accessibility to fast foods, takeaways and all that. It's not only is convenient, but it's it's tasty. So it appeals to people, especially in this age group. So the changes in people's lifestyle are mainly with what they eat and how accessible they are to those unhealthy foods that we label them as they are, contributes to the same problem. And I think it can be, we can say that it's something that we see in all the Pacific countries.
It's a bit strange to think that the issue is so big, it has so many consequences and is pretty much life-threatening, yet the solution is so simple. Is that why people aren't able to grasp the severity of what we're talking about when we say, NCDs are dangerous, you can lose your life if you don't make changes now?
Yeah, that's correct, Edwin. There's two sides of the story. Like obesity, as I've said, for the target group children, it's about eating and exercising. More important so is we can't stop people. You have to eat and exercise to be healthy. So really, for me, as I see it, it's not much of the obesity that we need to address. It's more towards the eating and the exercises, taking into account what Elisiva has shared, the change in the eating. So it moves us more into parenting. If we learn more about parenting and how to learn how food things have changed, we've changed from organic foods to now more supermarket foods. As I've said, in Fiji there is increasing evidence that we are eating from the supermarkets, and that's fine. We don't have to change from eating from the supermarkets. We can promote what the people are moving to the supermarkets. What we need to know now or learn as parents, or how do you feed children with food from the supermarket? That's the issue now that we need to address in Fiji so as to fight obesity. I don't want Fijians to lose their being big and beautiful. It's a food issue. If we can just control eating and exercise, we should be okay.
Elisiva, westernization, you mentioned the change in lifestyle doesn't just apply to the food that we eat now. People have less time to cook. They have less time to spend in the garden, even less time to spend with their children. But traditionally in the Pacific and even in Fiji, it's been thought that if your child is a certain weight, if they look chubby, they're healthy. Is that something that we're still battling with? And is that maybe something that we aren't able to identify as parents?
Yeah, I think it's. I'll just go back to and add on a bit to what Dr. Tukana was saying about changing people's dietary habits and making sure that they understand and they prioritize their health. It also, I think that the biggest challenge that we face is trying to change people's attitude and changing people's mindset. It's not just about educating them and telling them what to eat, what's healthy, and all of that, but it also involves trying to get them to agree to make the change. Because otherwise, if you make a decision not to change, doesn't matter how much education you've received, how much information you're given, it will all come down to your personal decision. In terms of perception of body size of children, I agree with you. I think years back it was perceived like if baby is of a certain weight, looking chubby and very cute and all, we look at that baby as a healthy baby, label them as healthy, but we're not saying that it's not that we focus on the size of the baby. There are other indicators that we have to look at, and it's not just baby putting on weight, but we also have to look at the way baby grows and with different indicators being put into it. So it has changed. It has changed because of the health outcomes associated with obesity. And as Dr. Tukana was saying, that if we try to intervene earlier on, the earliest that we can do with intervention, the lesser the problem will be, or the least chance for the children to be obese and end up with NCD.
We've pretty much identified the problem. I'd like to get into what the risks are in the future as children grow, but right now it's time for a break. We'll be back shortly. Good evening, welcome back to For the Record. We're talking about childhood obesity. Dr. Tukana, we've identified the problem. There are 1 in 5 adolescents who are overweight. Are we seeing these emerge into medical problems, health problems among these young children?
Yes, I mean, diabetes in young children will have the same kind of complications as diabetes in adults. Complications means skin complications. They'll have heart problems. They can have stroke. They can have kidney problems. And they can have eye problems. So it's just that there's a shift in the disease from an adult to the young, but the complications and the consequences are exactly the same. But it's happening in the younger generation.
We've already had, when we were speaking earlier, you mentioned that the youngest diabetic in Fiji is a 12-year-old.
Yes.
And the youngest stroke victim is another 12-year-old.
Yeah.
When this happens, what happens to the life of this child or these children who at this young age contracted diabetes and another who's had a stroke? How does their life change?
I mean, this child is still in the education phase as opposed to the adults. So all that, the time needed to look after this child and the number of times that he or she will be missing from school for the stroke case, the rehabilitation cost, and not only that, the time that the family needs to spend on the child, that adds up. If that is not enough, employment comes in. It will affect her chances of getting good employment or enjoying the employment because she or he has been sick very early in life. You must remember this is a chronic disease and it will take a whole lifetime. So the issue here is just that people in Fiji getting the disease is getting younger, which means they have to live longer with the disease and has to bear the consequences of them.
And what sort of challenges does that place on the ministry in terms of providing services and having more people coming to health centers and hospitals? And what sort of challenge does it pose to parents and society having a young generation, and this is a question to both of you, having a young generation which is increasingly more unhealthy, more susceptible to NCDs?
Medically, it simply means that we have to look after this child for a longer period of time. That means coming to the clinics, supplying the necessary medications, looking out for the complications, and if the complications arise, say a heart attack, or in case of stroke or renal failure, having to look after that complication, rehabilitation, that's for the child alone. And then once that child is affected, the whole family, the economics, the money side of the family comes in. It's a child who cannot look after his own, so that drains in money from the family, and the time you need somebody or the whole family to be aware of the situation of the child. So not only medically, but socially and economically, it drains, it will affect the whole family in the whole lifetime. We have to reset the whole the program for the child.
Refocus the energy towards
that child.
Towards the child. Elisiva?
I think the burden doesn't end with the family. It continues on, to the community, to whatever groups in the community that family or that person in particular is involved with, whether it's their church, the community at large. It will also affect the overall, everything that surrounds and everything that has some impact on that person's life. I think I'll just reflect back on my experiences back in Tonga. It's really alarming, and it's really a sad story to have to be able to witness those young children suffering from all those complications at a very early age. And even some of them have not got any of the complications yet, but because it's difficult for them to try and cope with the fact that they have been diagnosed with diabetes, and because of that, it's hard to get them to convince them to come to clinic, and then their diabetes is uncontrolled, and then they have all these problems, so they start missing out on school and and all of those things. So all these problems start coming in before the complications, are already settling in. So the person with diabetes is already, affected very much as early as when that person is being diagnosed. So it's not just that person and the family, but everybody else is being affected. If they're at school, the school system needs to be aware of the problem and what needs to be done. If they're in a youth group or any group in the community, they need to know. And I think with the interventions and the strategies that are being designed for each country and for the region in general, it's all trying to capture all the different settings that people will be in, so that wherever they are being looked after well. The problem is being addressed. Like you have health promoting school programs, you have health promoting church programs. So in all of those activities, they're being tailored in such a way that they capture the life, they're able to capture for everybody's needs in whatever stage of life they are and wherever they are in the community.
And with that, we've come to the end of another segment. When we come back, we'll look at what some of the future policies are to try and address this problem. Good evening and welcome back to the show. We are talking about childhood obesity, the consequences, the risks, and the solutions. Dr. Tukana, I would like to get into some of the policy initiatives that are being considered at the moment. But before we get there, we're talking about a generational problem. These are children, and more of them are contracting NCDs or being overweight. What happens on a national level when these children grow up and become workers and employees and employers? What are we talking about on an economic level?
Yeah, we are talking about a situation where if it's not looked after well, if you don't look after diabetes well, for example, at an old age, it will add more to the economic burden of society. Simply meaning we have to add more medical cost. As the disease progresses to complications, we have to be ready to take on the cost. If there are no policies in place to cover for this generation that's going to be diseased earlier, that will add cost, not only on the medical side, but on the employment side. That the case is more likely, if not looked after well, is more likely to be having more sick leaves, is more likely to be moving into complications, which might mean overseas referral or having complication case. So that's the socioeconomics that we are going into. And if they suffer from stroke or suffer from amputation, then it bears again onto the family and to the next generation that comes up. So those are some of the adult scenarios that will move into if these cases are not dealt with in treating the cause or not looked after well as they grow up
We're at risk of losing national productivity as well, because these children will grow up to be less healthy, and their output will be much less as well. When you consider that, when the parents who are sitting at home watching the show tonight, it all starts with them, doesn't it? Because it's hard to imagine that a child by the age of 11, just 11 years is not a very long time in a person's life, to be overweight in that time frame is a bit extreme. Elisiva?
Yeah, I agree with what Dr. Tukana was saying. The burden of the disease, and not just diabetes, but being the main NCDs that we talk about, but just NCDs as a whole, the burden that it imposes not only on the individual, but the family, the nation, and the region as well. So in terms of policies and other interventions that are being looked at now. At country level, at national level, each country in the Pacific have their own NCD strategy plan. And that plan usually operates on a 5-year basis. So I know for Fiji, they've got theirs started last year, was it? Yeah. So it's going, so each country has its own NCD strategy plan. And in that plan, it's supposed to be a multi-sectorial plan where all the NCD stakeholders and players are all involved in terms of activities and implementation of those activities. And they are all to address the 4 risk factors that Dr. Tukana mentioned at the beginning of the program. With SBC, part of our work that we're doing is to support countries with the development of the NCD strategy plan. So it's either supporting them to develop or supporting them to or strengthen the implementation and the monitoring and evaluation of it. At the regional level, we have the NCD roadmap, which was a document that SBC was commissioned to develop, and that was to address NCD risk factors not only at the health sector, but also to look at the socio-economic outcomes and all those determinants. In terms of policies in countries, in addition to the NCD strategy, countries have also got policies to address healthy eating, for example. So the schools have got school food policies, and that is to control what is being eaten within the school compound. There's also work now, a lot of countries, and we are supporting them to work on policies and legislations to promote healthy eating and physical activity, as well as tobacco and alcohol control. So that involves taxation, developing policies to control consumption and availability of sweetened and sugary beverages. That's one of the main areas that we're working on. Also looking at policies to control salt consumption by looking at reduction at different levels in the community. So those are the kind of policies, and those are the kind of work that is being done at regional level, as well as helping with each country to address the risk factors of NCD.
Dr. Tukana, some of these policies that Elisiva mentioned, are we likely to see results in the immediate future, in the long term, 5 years, 10 years, 20 years? Just a very quick response, please.
Yeah. The way Fiji is looking at it is, we are saying to ourselves it's a lifestyle problem. So we must start as early as possible from pregnancy. So we are targeting 4 programs in our fight to treat the cause. One is our antenatal clinics, our pregnancy clinics. It's trying to intervene there in terms of encouraging the mothers to live a healthy lifestyle. The statistics are showing us that death of mothers in pregnancy, some of them are related to lifestyle. So we are targeting, we already have a program in place. The next one is a maternal and child health clinic, where we look after mom and child for the first 5 years of life. And the third one now is the school health policy, where we looked after school children and adolescent health. If we fit in 2 things, nutrition and exercise, in these 4 existing programs, we should be seeing results in the foreseeable future. We have now reached our school health policy. We have just developed a child health strategy, and an adolescent strategy is coming in to address particularly eating and exercise and how to follow up Fijians, so as to avoid, create a healthy lifestyle, delay the onset of diabetes, and refer early when we catch them at that age group.
Okay, with that, we've come to the end of another segment. Don't go anywhere. We'll be back after this break. Lunaka, and welcome back to the show. The topic tonight, childhood obesity. Now, throughout the course of the show, we've spoken about the strategies and the policies that are being introduced and how we need to take responsibility. Parents need to take responsibility, schools as well. But there are certain external factors which sort of entice children. We're talking about manufacturers of unhealthy foods. We're talking about supermarkets which have very attractive displays of these junk foods, carbonated drinks, while the healthy food is stuffed away in the corner of the supermarket. How do we address these? How do we protect our children from these external influences? Advertising in the media, on television is also filled with these sort of food items. We understand businesses need to make profit, but there's a social corporate responsibility in there somewhere. It's an open question.
There's been some progress. Firstly, I would like to say that we've had our relationship with the food industry is becoming healthier. We have a project officer who sits with the WHO who's helping us talk to the food industry, and there are some changes already. Now you no longer see the noodles with children being advertised. You no longer see Oreo with a child being advertised. They've moved, they've done some things, making more teenagers or adults coming into the advertisement where we had children before. Secondly, we are working on some of the legislations. One is the regulation of the marketing of breast milk substitutes in that area. And the other big one that we are working now as government is the regulation of unhealthy foods and non-alcoholic beverages. At the same time, we are happy that government is supporting us in some of the initiatives like milk in class 1s. Those are some of the innovations that is helping us to fight against NCDs. The big one is the public health, what shall we say, the Public Health Act or the Public Health Bill is now before Parliament, which will be, so in the legislative side, there is some work in progress, but there needs to be more work done, especially as I've said, the children are being targeted in terms of nutrition. I mean, all the advertisements is for children. I hardly see any advertisements on food targeting adults because that's where the situation lies. And I'm happy that the government and the food industry are coming to terms in that area. Ministry of Agriculture, there's always work with the Ministry of Agriculture, promoting school health, gardening. We're working with extension officers to promote school health gardening especially. On the physical activity side, our children are being, there's now a school curriculum in physical activity just launched by the Ministry of Education. The challenge there is the technology. Fijian children now seem to sit more with their gadgets rather than playing cowboys and pani and all those games we used to play before. So these are the challenges. But I keep saying it's parenting. I mean, by the time the child reaches school, is already 6 years late. The lifestyle has already been established in the first 5 to 6 years. And I feel that's where the investment lies, on how we keep educating. And it may be a corporate social responsibility that the corporate helps us in educating the mothers on how to feed the children properly.
I'm interested in what you mentioned about legislation on unhealthy food and drinks. What exactly is the ministry looking at? What sort of regulations are we talking about?
It's a WHO regulation. We are talking about marketing of unhealthy foods to using children in marketing, and working with the media industry to try and have some sort of agreement not to advertise unhealthy foods when the children are at home. Those are the kind of issues we are working with at the moment.
Elisiva, across the Pacific, I know the Pacific community works on a policy level and advisory level, but would you say there is a need for more collaboration between the private sector and governments and the ministries of health in this regard?
Yeah, I think the issues that you've been mentioning, talking about advertisement using children for unhealthy foods, most countries are addressing that using legislations. But I think what's most important is advocacy and communication, and it needs to be done up to the top level. I think if we are able to involve leadership, at the highest level of each country, and then that they are aware of the problem, that we have their support to support all the interventions that health and other sectors are coming up with. It will make it easier, when you have that kind of support and you have that kind of leadership from our leaders in each country. And at SBC, that is one of the areas that we support countries with, is try to get the countries to take ownership and take leadership in the interventions and the strategies that each country has come up with to tackle the four risk factors. So I think if we are able to do that, that will make things easier. It will make communications, it will make implementation of all these legislations and all these policies easier to be implemented and have some positive impacts in our children's health.
And with that, we have to take another break. We'll be back shortly. Good evening, welcome back to the show. Our last segment for this evening, our topic is childhood obesity. Dr. Tugana, you have been a champion of fighting NCDs and getting people to make the right choices and live a healthy lifestyle. My question to you is, do you sometimes feel that we are fighting a losing battle?
Thank you, Edwin. That's a very important question. I've never thought that we are fighting a losing battle. I've always thought that it's a battle to be fought. And now the movement, my personal thinking is, rather than reacting to non-communicable disease, we need to create a lifestyle, and that creation needs to start from childhood. I've mentioned basically two things. Obesity is to do with eating and is to do with exercise. The challenge is now that eating in our children, we've changed the menu. We've moved away from organic foods to processed foods. Parents need to learn how to give their children processed foods, and there are clinics all over the country that will be able to advise you on how to eat processed foods. Number two, technology is coming in. More children are having more time sitting rather than exercising. We also have plans in place, the education system. So I think in solving the problem, I have always been very hopeful of the potential that parents have if we give the right awareness that they should be able to work. Two things have changed. They've moved from organic to processed foods, and they need to move more with the gadgets coming in. At the same time, government has really been supportive in promoting legislation. I think it will just take time. The legislations are moving up the ladder. We have that public health bill now before Parliament that now addresses NCD, which was never addressed before. These are the two issues that we are.
Receiver, what trend are we seeing in terms of the movement or the prevalence of NCDs? We're talking about NCDs being the biggest killer in Fiji and the Pacific. Now we're talking about NCDs, obesity and NCDs among children. The good doctor has pointed out all these efforts which are being made, but are we seeing change on the ground?
I like the comment that he said that this is a battle to be fought. It's not a losing battle, and I think for people who have worked in the area of NCDs for a while, would know what it's like, and would know the true meaning of what Dr. Tukana was just commenting on. But unfortunately, with all these efforts that we've been putting into the fight against NCDs, we still see the rise in the risk factors. We still see the rise in the prevalence of NCDs, especially with diabetes. But I think with the with the recent survey results from WHO's STEPS survey, some countries have shown some improvement in terms of diabetes prevalence. Some countries maybe not that significant, but we are starting to see some changes, and we're hoping that that would continue on to be something that we continue on the path that we would like things to turn out to be. But I think what we want, not only at the national level but also for the region in general, is we all need to be aware, and we all need to understand that NCD is everybody's business. It's not a health problem. It's not Fiji's problem, or it's not Tonga's problem. It's everybody's problem, and because it's everybody's problem, it's everybody then is expected to have some kind of a responsibility, to take some kind of ownership, and try and work together in order to achieve outcomes that we would like to see in the near future.
Elisiva, Dr. Tukana, thank you very much for being on the show tonight. That's all the time we have. I wish you all the very best in your efforts.
Thank you.
And that was our show for tonight. Remember, if you have comments or questions, you can email us for the record at fbc.com.fj. Good evening from me. I will see you next Sunday. Modemanda.